I'm calling this section of the study guide soft tissue structures, but I will be talking about some miscellaneous structures that probably couldn't be classified as soft tissue, but they didn't really seem to fit elsewhere in the study guide, and they fit nicely here, so I'm sorry if that naming is a little confusing. I'm first going to be talking about some of the muscles that cover like the face and the skull and are in the neck. There's a bunch of tiny muscles. I'm only going to be talking about some of the big important ones. First we have the frontalis. It's a big flat muscle on our forehead. It helps us do things like raise our eyebrows and wrinkle our forehead. The orbicularis oculi is a sphincter muscle that circles around the eyes or the eye sockets and helps us do things like wink and squint. The zygomatics are sometimes called the smiling muscles because they pull our mouth up at the corners. On the side of the skull, we have both the temporalis and masseter muscles, and these are the mastication or chewing muscles because they help us close our jaw. The buccinators are here in our cheeks. They help us do things like suck in our cheeks and perform actions like whistling. The orbicularis oris is another sphincter muscle, much like the orbicularis oculi. It circles around the mouth and lets us do things like purse our lips. In our neck, we have the trapezius. This is responsible for extension of the neck, so when we put our head back, and also for shrugging our shoulders, among other things. And then we also have the sternomastoids. These, both the trapezius and the sternomastoids connect with the clavicle. The sternomastoids allow flexion of the neck, so when you put your head forward, so it's sometimes called the praying muscle. This is a sagittal slice, like through the center of the head. I forgot to draw on the separation there between the trachea and the esophagus, so please make sure to do that. Some regions here are some landmarks. We have the nasal cavity and the oral cavity. I'm first going to be talking about the pharynx and larynx segments. The pharynx is the region that connects the oral and nasal cavities to the esophagus, so anything that you breathe in or eat or drink will be passing through the pharynx on its way to either the esophagus or the trachea. There are 3 subdivisions. I'm going to be listing them from most superior to most inferior, so top to bottom. First we have the nasopharynx. This is behind the nasal cavity. The oropharynx is behind the oral cavity, and the laryngopharynx is under both of these. Drawn where the trachea and the esophagus are. The trachea is more anterior, esophagus is posterior. The larynx connects the pharynx to the trachea. So that's this little segment right here. It's really important for controlling the air movement and also like where food and stuff is going. And it also contains the voice box. It lets us speak and make noises. The epiglottis is a flap, like a membrane flap that covers the larynx and prevents food and drink from entering the trachea or the lungs when we eat, or like when we're swallowing, we're eating or drinking. The glottis is a separate structure from the epiglottis. It is triangular in shape when you see it on like a CT, and it contains the vocal cords, both the false and true vocal cords. So here's a CT so that you can see it. There's like a darker triangular shape there. That is the glottis. Next, I'm going to be talking about some of the exocrine glands that can be found in the head, and specifically this is the salivary glands. And these produce saliva that will help us chew, like soften up our food and make it so it's easier to swallow. And they also, the saliva contains some digestive enzymes. So we're starting the digestive process with these exocrine glands. There are 3 groups of them. The first one is the parotid, and then the submandibular, and then the sublingual. This image here on the right is a CT where you can see the parotid glands. They're kind of on the side of the head. They're pretty large. I'm going to draw them here, the parotid in purple. Let's do the submandibular in red. And so submandibular, it's like below the mandible, right? and then the sublingual, so below, and then lingual referring to the tongue, so under the tongue. Speaking of the tongue, here's a CT. It's very large in the mouth, especially when you're looking at it like on a CT or MRI or something. It takes up a lot of space in the oral cavity. It's mostly muscular. Like I said, it's in the oral cavity. It helps with chewing and swallowing, so we can like move the food around and get it in our teeth where we need it, and then push it down our throat. And also contains taste buds. It reaches from the oral cavity all the way to the oropharynx. So, next up is teeth. I keep mentioning the teeth when I'm talking about chewing. So obviously, teeth are important for chewing, so they play a role in our digestive system. They also help us speak, kind of, forming different words and sounds. This bottom one is a panoramic CT that you might get at like the dentist's office. It contains non-erupted teeth. The sagittal CT here has just been magnified so we can see all the different parts of the tooth. The top, the most radio-opaque there, that's the enamel. Then we have the dentin, just the lighter gray. The darker colors, the pulp, and then we have the root canal. And this is like where the nerves and blood supply come from for the tooth, because it is a living, tissue. We have the periodontal ligament space around the tooth. This is like very radiofluorescent, or there, radiolucent is what I meant to say. Next finally we have the hard and soft palates. The hard palate separates the nasal and oral cavities from each other, and then the soft palate separates the oral cavity from the nasopharynx, and when you're swallowing it actually like moves up so that theoretically food and drink won't get into your nose. I think we've all probably had that fail a time or two in our life. That's not the image I wanted to use, I realize. There we go. So the hard palate actually has bone in it, which is why it's hard. You can feel that on the roof of your mouth, like with your tongue or your fingers. So it's easy to tell the difference on a scan, or specifically a CT scan. And then the soft palate is behind it, more radiolucent, because it's soft tissue. Thank you for watching these notes. Please refer back to the other segments of this website if you have any questions about the rest of the head and neck.